I'm Dr. Parsa Mohebi, a hair transplant surgeon in Los Angeles, California. I would like to talk to you about hair restoration, FUE hair transplant procedure, and everything that's involved with the process and who's a good candidate and how it's done. FUE hair transplant is when we remove hair from one part of the body and transplant it to the other part. FUE stands for follicular unit excision, traditionally follicular unit extraction. That's the method that the surgeon goes and remove follicular units, the natural grouping of the hair, and move it from one area, extract it or excise it from the skin and put it in another area. FUE hair transplant could be done traditionally when we shave the head, the back, and recipient area. We remove the hair and transplant hair, extract hair from the back, and put them on the recipient area. However, in the last few years, we've been becoming more innovative with FUE procedure. So we can do FUE without shaving head. Sometimes we remove them as long hair exists, so we go between hair and cut one hair and remove it, cut another hair and remove it. Sometimes we don't even cut those, we keep them as long hair. We have certain devices that let us remove hair, FUE grafts, as they have long hair. We can do body hair transplants or beard to scalp hair transplant. These are the types that are good for people who don't have enough donor hair on the back of the head. So if a patient doesn't have enough hair on the back, we go after other areas. So scalp, beard, and body, those are the priorities of extraction of hair. Men, most of them with typical male pattern hair loss, they're good candidates. They lose hair on front, top, or crown. They keep the hair on the back and sides. Women with male pattern hair loss, they're good candidates for hair transplants because they lose hair on certain areas of front and top, and they keep a good density of the hair on the back and sides. If you're not sure if you're a good candidate for hair transplant or not, just put your fingers through your fingers between your hair and see how thick it is on the back and compared with front. If there's a significant difference, it means that you probably are a good candidate for hair transplant. Women with female pattern hair loss are the ones that are losing hair everywhere. So even hair on the donor area are not as good and solid. The other candidates for hair transplants are people who have scars. Surgical scars, trauma, anything that causes a permanent scar on the scalp, that can damage hair. And that visibility of the scar sometimes is because of lack of hair. By putting hair into the scar, we can get rid of the visibility of the scar. Other candidates are people who are lacking facial hair, that we can remove hair from other areas and put them on the beard area and recreate their facial hair for them. Or people with some congenital conditions. Some people congenitally don't have enough hair in certain area, or they're having patchy hair loss that could be restored with hair restoration. Women with naturally high hairline, that the faces become like a man face, masculine face. So we can easily bring that hairline lower and make it more feminine for them. Hair transplant cost has to do with the area of hair loss more than anything else. So basically, if you have a big area of baldness, you need more number of grafts. The more grafts, the more time needed for your procedure and the more expensive it is. The types of hair restoration are different. Like traditional strip procedure was cheaper, the FUE procedure are more expensive. Certain type of hair restoration that we don't even shave head, like celebrity FUE or non-shaven FUE, we charge more because they're more labor intense. Obviously, the overall cost also has to do with the location of the patient and overall cost of medical treatments. So how to get prepared for a hair transplant procedure? First of all, you have to find the hair transplant surgeon that you trust. There's many sources. You can search online. You can look at before and after photos, patient results, reviews, and everything. When you find your doctor, you have to set up a consultation. In the consultation, the doctor will evaluate your hair and your scalp microscopically and macroscopically. He should come up with a plan, a master plan, how to maintain your hair throughout your life. So it's not about just hair restoration, it's about prevention of further hair loss too. So we're talking about medical treatment, surgical treatment, even cosmetic modification to make your hair look better. After that, the doctor plans for your procedure and gives you the instructions. Then you have to get prepared for a hair transplant. A FUE hair transplant is very simple how to get prepared for it. You just have to wash your hair, clean your hair, show up the day of procedure. Most doctors are doing the trimming, if needed, the day of procedure in their office because they need a certain length. And then be prepared for after procedure to have a ride because you might be under sedation and you need to have somebody to take you home. Hair transplant is basically moving hair from one area of the skin or body to the other. In order to do that, the first step that we do in our office is we design the hairline. If there's any hairline involved, we have to design it ahead of time so we know where to put hair, what is the distribution of the hair, and what are the densities of each areas. After that, we take the patient to the procedure room and we start with trimming or shaving if need be. The next step is local anesthesia, sometimes sedation, sometimes just local anesthesia. Patients may feel a little bit of a pinching here and there, and after that everything is numb. What we usually do is a ring block, which is blocking around the scalp so both donor and recipient area are going to be numb at the same time. After local anesthesia, we're going to move on to making sites. So we design the small holes or incisions that grafts will be placed into. So that's probably the most artistic part of the procedure, is where the physician makes small incisions that eventually the surgical team will fill it with the grafts that are harvested. After site making, we change patient's position and start extracting the grafts. So extraction of the grafts done by the hair transplant surgeon, and we have to remove hair one at a time. The team of technicians will help the surgeon to collect the extracted grafts or excised grafts. They collect them, prepare them under microscope, look at them, make sure they're all intact, and then deliver them to the placing team that are placing the grafts, sometimes as the grafts are being harvested. So the next step is when we place the grafts into the pre-made sites. That could be done by special forceps or special implanters or inserters that insert the grafts into the pre-made sites. At the end of the procedure, the surgeon usually do the overall inspection, make sure all the gaps are filled, make sure every hair is pointing to the right direction, even the curvature of hair will be adjusted, and then we put a bandage around the patient's scalp if need be, and patient will be released from the procedure. Hair transplant result is something that, unlike many other cosmetic procedures, cannot be appreciated immediately. Right after procedure, patients are seeing some redness on the recipient area, some little small holes on the donor area, but it's going to be healed very quickly. So after the first few days, the scalp goes back to normal. Maybe you have some redness, maybe minimal pinkish discoloration for even days or weeks after procedure, but it will get better and better as time goes. At the beginning, the hairs are very short and very small, and they become thicker and longer over the next few months. At 6 to 8 months, you see enough long hair so you can comb it and styling it the way you want. The best result is probably seen after 8 to 12 months, when hair is long enough so you can style it and comb it the way you want. Risks and complications of hair restorations are very limited. With FUE procedure on the donor area, you see some red dots right after procedure. It may be still visible for 2 or 3 days. On recipient area, you may see some redness for days, occasionally 2 weeks. Some scabbing that will probably last for 4 or 5 days. If the hair wash is done properly, they should be gone after day 5. Occasionally people may have pimples on recipient area, pimple-looking lesions that they come and go, they won't affect the growth of hairs. We call them folliculitis. If they're more than 2 or 3 or they're painful, the patient can come back to the office and the doctor can incise them for them. Alternatives to FUE hair transplants are obviously that the patient doesn't have to do anything. So keep balding, shave the head, and be happy with it. The other alternatives are using the more traditional methods of hair restoration, so like a strip procedure. Strip procedure is still being done, but it has its own consequences, its own complications. Patient has to know exactly what he's receiving and what are the problems that could not be easily reversed. The other alternative is SMP, or scalp micropigmentation, which is putting small pigments into the scalp that minimizes the contrast between the skin color and hair color, and basically hides the baldness, so that appears see-through effect that shows that your thinning hair is going to be gone. So if hair loss has ever been a problem in your life, we have so many options. FUE hair restoration is one of the best options for restoring hair in most type of pattern hair losses. Also with different types of hair loss like beard hair loss or patchy hair loss of different types that could be treated with hair restoration. FUE hair restoration is one of the best options today for restoring your hair naturally and with minimal complications and side effects. So if you are planning to do this, find a hair transplant doctor who are capable of giving you the result that you want. There's so many websites out there like Cosmetic Town that can give you information about how to get prepared and how to find the right choice of cosmetic surgery. I hope you learned from this video and that could have answered some of your questions. Thank you for watching.